I'm going to ask I'm going to ask Julia to add on to that. I mean, I think Dr. Cox has highlighted food as a daily habit or a daily lifestyle part of our life that can help promote mental health. So again, like, what is mental health? And she's again highlighted that it's not just when we have, like, extreme mental disorders. So what is it? What is it?
That's that's a tall order. I think it's, a lot of what I was hearing from Dr. Cox, and thank you for really highlighting the importance of wellness and prevention. And then also I've heard resilience come up a lot. And so, mental, and everybody might have a different take on what exactly mental health or mental wellness is, but it's really the ability to adapt and cope and continue to function irrespective of the stressors that are coming at you. And there are different ways to maintain that, whether it's, diet, exercise is a big one. I'm a big proponent for exercise in terms of its benefits, not just physical benefits, but emotional benefits, it's cognitive benefits. And there's a lot of research to support, those aspects of aerobic exercise and also other types of mind-body exercise like yoga, tai chi, etc. But, I wanted to kind of go back a little bit to the idea of stigma and, promoting wellness. I think people are much more likely to accept that and say, well, this is good for my health. I'll do this, I'll do that. And it's good for my health, both mind, body, spirit, etc. But what happens when it crosses that line to a disorder and you have somebody who refuses to get help, or because of the stigma, just doesn't acknowledge that something's wrong? And I work in a hospital, I get consulted, and sometimes I get consulted to see patients who don't know that psychiatry has been consulted. So you can imagine I walk in and they're like, who are you and why are you here? And they don't want to talk to me. And so, I see that a lot. And, in the community, it's, family members trying to convince somebody to go see somebody. And one approach, it's not the only approach, but one approach that I found that may help is to just say, well, what do you think is going on? What things are you having difficulties? Let the person define, what it is that they're struggling with. Because if you come in and you say, well, they're concerned that you have depression, well, they might not define what's going on with them as depression. I don't have that. I reject that. I can see a Nigerian. I reject that in Jesus' name. That's not me. But if you let them define it in their own words, what is going on? Well, I'm not sleeping. I'm just tired all the time. Well, then you can talk about some things that can help with those particular things, like exercise, like diet, like having somebody to talk to, or maybe it's time for a medication. So letting the patient define what's going on with them through their own cultural lens, I think, can be something that's helpful.
Thank you so much. And is it possible? You just created a scenario for me that I didn't think was possible. Is it possible to get someone to come and see you or any other clinical psychologist that way? Hey, you just walk in the room and they were not expecting you. Like, how would
That's
that?
not recommended.
Exactly.
So yeah, we shouldn't trick them to do that. I wouldn't recommend that at all. You could suggest seeing a primary care doctor. I've noticed you're just very listless or much more irritable, or sometimes if it's medicalized, I might say, well, I'll go see my primary care doctor. And then depending on how they interact, they may be willing to consider that maybe there is mental health aspects to what's going on, which doesn't necessarily mean medication or hospital or anything like that. It could just mean some other measures to help them to do better.
Awesome. Thank you. I'm going to ask Dr. Cox to add on a little bit to that.
So other thing that I wanted to talk a little bit about is the definition of mental health is, traditionally what I think about, is really the lack of self-care, at the all levels. And I know Dr. Julia talked about the functional level, but especially, I hate to say this, maybe it sounds like a stereotypes and I apologize, but some of the Asian, it's a bimodal distribution for the Asian patients. One population, we can really measure mental health with a functional level, but we have such a large population of functional addicts, functional mental health patients, And I actually see, in African American population as well too, they can tolerate this. They are suicidal every day, but somehow nobody knows, you know. And so we need to also really have the radar out for people, who are rocking the community, who does everything and high achieving, but they are suffering pretty severe mental health problem for years and years and years, And in Ohio too, if you look at the statistic of a heroin addiction, opium crisis, it's just like your typical Skid Row, typical addict to, we again have a bimodal distribution of pretty high functioning heroin addict that I just cannot believe, last few years of seeing people who are able to maintain high level jobs and have been shooting up for, addict every day for last 3-4 years, or top students, or, so it's again, a very deceptive for us to really look at, again, I mean, having said mental health is a lack of self-care, but there are people who are pretty looking resilient, looking pretty successful, who are very much of a high functioning mental health patients as well. And they suffer, again, part of that is that because of the stigma, because of that is, how can they, as a very successful, high functioning whoever, can come out as having lifelong chronic mental health, problem or disorder, that it just really is a difficult things for us to really grapple with as a profession. Yeah.
That definitely makes it a little bit challenging. So just